So we're talking about skin pressure injuries in people with intellectual and developmental disabilities. So who is most vulnerable? Well, if you think about it, remember, a pressure injury results from a tissue being compressed, not getting enough blood flow, right? So people who don't move as well can be at increased risk for pressure injuries because they may sit in the same position. They aren't able to move to different positions. This can cause prolonged pressure in a particular area that can result in this type of damage. So we think about people who may have cerebral palsy, may have spina bifida, spinal cord injuries, traumatic brain injuries. Sometimes people with genetic syndromes aren't able to move as well. So these, the bottom line is really just to think about movement. If a person is not able to move well on their own, they're going to be more at risk. Now, there are some diseases that put people at greater risk as well, too. Some chronic conditions like diabetes. Diabetes kind of interferes with the circulation in the small capillaries. And again, that messes up with blood flow, so they can be more prone to pressure injuries. People who have poor circulation, people who have a low blood count, who are anemic, maybe they have some sort of immunocompromised condition. People who have poor nutrition can be at greater risk as well, too. So, again, nutritional issues, chronic medical problems, people who aren't able to move as well, and also people who maybe can't recognize the need to change a position as well, too. We also see pressure injuries more often in people that are older, but this isn't always the case, and also people that have thin and fragile and dry skin. So those are some people or groups to think about when we're looking at people that are more at risk for pressure injuries. Next time, we'll talk a little bit more about pressure injuries and what we can do to reduce the risk.